Uncivilized Vitality Anatomy playlist. We're going to talk about the vertebral column today. I'm going to call this Spine 1. So this will be introduction to the vertebral column. We'll talk about the individual vertebrae. We'll talk about the ligaments. We'll talk about the musculature. We'll do that in a series of videos around the spine. So today let's just talk about the spine in general. So you've got total 33, what they're called vertebrae, right? Or vertebra, singular. There are 33 of them. There are 7 cervicals in the neck. There are 12 thoracic, right? That's in the, say your trunk or your chest cavity. And then there are 5 lumbar vertebrae. There are 5 sacral vertebrae, and there are 3 to 4 coccygeal vertebrae. So the 5 sacral are typically fused into one, and the coccygeal 3 to 4 segments are also fused into one at the sacrum and the tailbone. So you're typically going to get about 24 movable vertebrae and the sacrum and the tailbone, okay, all together. This is going to form your vertebral column, okay? Now, I say typically 24. Some people have transitional or extra vertebrae, extra lumbar, extra cervical. It just happens. But for the most part, you have the 24. Now, if you were, when you were a baby, your spine was curved. Your vertebral column was curved from your neck down to your tail. There's your pelvis, and you had your little feet up in the air, and your little shoulder girdle with your arms, right? But your spinal column or vertebral column was curved in a concavity in the anterior direction. So you're concave anteriorly. That means you're sort of scooped out toward the front. And you think about this, you know, as a tiny infant, you were wadded up inside. As a fetus, you were wadded up inside the uterus. So you're kind of curled around like that. As you get out and start moving around as a baby, you're going to start lifting up that giant dome of a head. And that's going to cause the curve to reverse in the cervical region. Okay? So now you're starting to lift that head up, you'll get a reversed curve in the cervical region. And then as you start to sit up, the little baby sits up, learns to push up in a seated position. As they learn to stabilize their torso and their head above their pelvis, which is seated on the floor, you'll get a slight reversal in the lumbar area as well. Okay, so you're going to get the main curve, which was concave anteriorly, and you're getting a reversal of 2 sections of the vertebral column as you start to bear weight vertically in gravity. And those 2 curves are going to end up concave posteriorly. So they're going to, you can think of it as switching directions, or you can just think about it as going from a concavity to a convexity facing toward the front. The ones that were, the curves that remain in the adult spine with this little kind of S shape, the ones that remain in the same orientation as the fetal spine are called primary curves. And you can also refer to these as kyphoses. Okay? And then the secondary curves that come in the cervical and the lumbar, these secondary curves are referred to as lordoses. Okay? Now the alternating lordotic and kyphotic curves all the way down through the spine will give you a almost like a spring, depending on well, in conjunction with the individual anatomy of the vertebra and the intervertebral discs, which we'll talk about in a second. Gives you almost a spring to kind of keep the head supported and allow that musculature to facilitate upright orientation and gravity. Your body is going to attach to your pelvis. That's an anatomically accurate pelvis. You just have to pretend. At the sacrum, with the 2 ilia on either side, the sacroiliac joints, and then the pelvis will join at the 2 pubic bones, right and left in the front at the pubic symphysis. and allow weight to be distributed from the head, the torso, the shoulders and upper limbs, and anything you're doing with that will be distributed via the spine or the vertebral column down to the pelvis, and then down through your lower extremities to the ground. Right? So that is the first kind of overview of the shape of the spine. You have 33 vertebrae, 24 movable so-called vertebrae, 7 cervical, 12 thoracic, 5 lumbar, 1 sacrum fused from 5 sacral vertebra, 1 tailbone of those 3 to 4 coccygeal segments. And then we'll do the individual segments in other videos. We'll draw out the vertebra so you can see how they're shaped differently, represents their function in their form, the way the shapes are distributed amongst the vertebral column. Obviously, cervical vertebra will be a little smaller, not as robust and large as lumbar vertebra, which are sort of at the bottom of the stack. We'll talk about the different osseous landmarks you're going to need to know for basic vertebral anatomy. And then we will move forward in the next video.